Hello everyone, I am Dr. Sachin Kadam, consultant surgical oncologist. I am practicing and attached with the Cure Multispeciality Hospital, which is located at Kapurbawadi, Thane. So we are going to start about the session for colorectal cancer screening and awareness. So which are the common cancers that we can prevent with screening? Prostate, yeah, we are doing PSA and digital rectal examination, but we can detect it prostate, but we can't prevent it. It is same with the breast also. Mammographically we can detect it, but prevention is not possible with screening. In case of colorectal cancer, we can detect it with colonoscopy, visualize the proper polyps, and we can remove it. So colorectal cancer is the only cancer that we can prevent it with screening. As I already told, March is the colorectal cancer awareness month, and all activities regarding awareness of colorectal cancer, screening of colorectal cancer, these all activities are conducted in the month of March all over the world. So why colorectal cancer is very important to know about its pathogenesis, screening, everything about colorectal cancer. So you can see American College of Gastroenterology, they have published their figures in the last year, that is 2020. So in the United States, colorectal cancer is the third most common cancer in both males and female. And the lifetime risk of colorectal cancer in men is 1 in 23 and the same for females is 1 in 25. They have mentioned people who are born around 1990, they have the twice risk of colon cancer and about 4 times the risk of rectal cancer. So you can imagine the incidence and prevalence of colorectal cancer in US. If you see the figures from India, which is published by Globocan 2020, all sexes, the number of new cases in 2020, the colorectal cancer stands at the fourth position with accountability of 4.9% of cases. In case of males, the figures are around 6.3%, so it is higher in males, and in females, it is around 3.7%. So you can imagine the incidence is increasing in India also. So it is very important to know everything about the colorectal cancer. There is one consumer education guide which was published by American College of Gastroenterology. So this guide is for the patients. They have explained in a very simple and easy language everything about the colon and rectal cancer. So I have gathered information from this ACG. Understanding colorectal cancer. Before proceeding for screening, we should know everything about the risk factors, pathogenesis, the treatment of colorectal cancer. Then we can proceed for screening. So this is the picture of a large bowel that we call colon and rectum. So it starts from the cecum appendix. This is the cecum, this is the ascending colon, hepatic flexure, transverse colon, splenic flexure, descending colon, sigmoid colon, and rectum. So this cecum to hepatic flexure, it is called right colon, and below splenic flexure is the left colon. If you see pathologically, there were 4 layers of colon and rectum, starting from inner layer, that is mucosa, submucosa, muscularis propria, and serosa. So where does this colorectal cancer starts? If you see these pictures of polyps, these are called polyps. So what are polyps? Polyps are the outgrowths from the inner layer of the colon and rectum, that is mucosa. Their growth is from the mucosa and they are benign. When there is changes of cancers, when they turn into cancers, they spread to the inner layers like submucosa or muscularis propria. Then we call them as adenomas. So remember, all polyps are not adenomas. Colonoscopy helps in direct visualization of these polyps and we can remove it, and in this way we can prevent it. In a simple way, this is the stages of a colon and rectal cancer. Stage 0, you can see there is only a polyp without any non-cancerous growth. In stage 1, there will be changes of carcinogenesis. Stage 2, It involves the inner layer, then starting with the inner layer, they involve the four layers and spread to the surrounding tissues. In stage 3, it spread to lymph nodes. In stage 4, it spread to other organs, and then it becomes metastatic colorectal cancer. Which are the risk factors we face daily in our routine practice for colorectal cancer? So lifetime risk of colorectal cancer is 1 in 20, and there is an equal incidence or frequencies of colorectal cancer in both men and women. Most commonly, it is diagnosed after the age of 50, but young people are also affected by colorectal cancer. The people who are living long, there is a lifetime risk of colorectal cancer. So age is the most important risk factor for colorectal cancer. How about the dietary risk factors? People who consume diet which is high in red meats like beef, pork, lamb, or processed meat like hot dogs, or cooking the meat at a very high temperature like frying, broiling, or grilling, these people are at risk of colorectal cancer. It is said that cooking at a high temperature releases some chemicals that initiates carcinogenesis. Some people are consuming excess fat in the diet, so they are also at risk of colorectal cancer. But it is not clear for how long and how much quantity are you consuming, and you will be at risk of colorectal cancer. So better to avoid this type of diet. Other factors like cigarette smoking, physical inactivity, which ultimately leads to obesity, heavy alcohol drinking or moderate to heavy alcohol drinking. Post cholecystectomy patients are also at risk of colorectal cancer. People who are treated or suffered from uterine or ovarian cancers before the age of 40, they are also at risk of colorectal cancer. Then if there is a family history of colorectal cancer, or if there is a family history of adenomas, or who are suffering from inflammatory bowel diseases like colitis or Crohn's colitis, they will be at higher risk of colorectal cancers. So we divide people who will be at high risk and who will be at average risk. So people average risk will be having no such factors that get defined in the high risk category. So which are the people who are considered as high risk? If there is a personal history of colorectal cancer, or he has been treated or suffered from colorectal cancer or polyps, if there is a strong family history, if first degree relatives are affected with the colorectal cancer, they are also at risk of developing colorectal cancer in the future. Inherited forms of colorectal polyps or cancer like FAP, familial adenomatous polyposis, and HNPCC, that is hereditary non-polyposis colorectal cancer, that we call Lynch syndrome. These people are also at risk of colorectal cancer. And inflammatory bowel diseases like Crohn's disease or ulcerative colitis. So people who are having this type of risk factors, they are considered at high risk for developing colorectal cancers. And who doesn't have these risk factors, they are considered at average risk. So there are different guidelines for high risk and average risk. Which are the most common symptoms? Whenever a colorectal cancer starts in the early phase, the patient will be asymptomatic. There will not be any symptoms. But when he becomes symptomatic, that time the cancer will grow. It may be in advanced stage or incurable. So which are the most common symptoms people will face? Like unexplained new onset of abdominal pain, disorders also. So if these symptoms are present, so it is not like that the patient will have colorectal cancer. But if the symptoms are persisting for more than 3 to 4 weeks, the patient need attention and should visit a nearby physician. Now proceeding for the screening options or screening test, the American College of Gastroenterology, they have divided screening test into two categories. The first is preventive test, which prevents, directly detects and also prevents, that is colonoscopy, and the other test, that is the detection test, that we call FIT, that is fecal immunochemical test. In a simple way, we can divide this stool based and directly visualized test. Stool based test like FIT, fecal immunochemical test, they detect blood in or on the stool. Then FOBT, that is, it is based on guaiac reagent, fecal occult blood test. And the third is multi-target stool DNA test. So these all tests we can done at OPD basis. There is no need of bowel preparation, but they are having low sensitivity for right colon. If upper GI bleed also is there, the test will come positive. So this is the disadvantages of all these tests. Direct visualization, colonoscopy. This is the gold standard for screening and detection that we can see from rectum to cecum. The whole large bowel we can visualize. If positive finding that, we can remove it and prevent it. Colonoscopy is also less sensitivity for right colon because the lesions in the right colon are flat and they are very aggressive as compared to left colon. The next is CT colonography. CT colonography, it is a virtual colonoscopy. Here we inflate rectum with carbon dioxide or air and we see under with intravenous contrast under CT. The images will be constructed in a 3D format and we can see the pathology. And sigmoidoscopy. Sigmoidoscopy is visualization till the splenic flexure. If positive findings are there in the sigmoidoscopy, then it needs to be evaluated with complete colonic evaluation with colonoscopy. The fourth one is capsule endoscopy. Here, one capsule patient takes orally. There is a camera inside the capsule that directly we can see on the monitor. So all this test is required bowel preparation. So before night, patient has to be given laxatives. The bowel should be clean. If bowel is not prepared, then maybe a repeat colonoscopy is required. This is the 3D format pictures of a CT colonography. You can see the images are constructed in a 3D format. Now the screening guidelines given by American College of Gastroenterology, the people who are at average risk that we have discussed, who doesn't have the high risk factors, the screening recommendation is colonoscopy every 10 years. The age range is 45 to 75 years. And other tests like blood test, FIT or FOBT or DNA test, their recommendation is every 1 year. If all clinical findings are negative and colonoscopy is negative, the recommendation is 10 years. Above 75 years, it's an individual decision. So ACG has divided screening test into one step test and two step test. So first is colonoscopy. Directly you can visualize, detect and remove it, and in this way you can prevent it. Two-step test already discussed, stool based, sigmoidoscopy and imaging test. All these tests come in the first test. If they find anything positive in the colon or rectum, the second test is evaluate with colonoscopy. The National Comprehensive Cancer Network 2021, their guidelines recommend colonoscopy every 10 years. The difference only their recommendation for sigmoidoscopy is 5 to 10 years and CT colonography is 5 years. And other tests are annually. Only DNA they have recommended 3 years. The sensitivity, you can see the sensitivity and specificity is more for colonoscopy. These are the pictures of a polyp which was detected by colonoscopy and it was removed. So, should I wait until I get symptoms to get checked for colorectal cancer? The answer is no, because in the early colon cancer or rectal cancer, patient will be asymptomatic. But when the symptoms start, that time it will be in the advanced stage or maybe incurable. So, recommendation for all colorectal cancer or at average risk people is screening. But the colonoscopy, which is the gold standard, it is an invasive procedure and people are reluctant for the procedure. And we are always having excuses for screening. But in case of colorectal cancer, excuses lead to a deadly delay. So which are the excuses? Colonoscopy. I am healthy. Why I get screened? ACG has recommended colonoscopy for healthy individual. So it doesn't like I'm healthy and why should I get screened? I recommend colonoscopy. No one in my family had a colon cancer. There is around 500 people are about to get colorectal cancer in their lifetime, irrespective of any positive family history. So if one person doesn't have a positive family history, it doesn't mean that he will be not at risk. So recommend colonoscopy for these people also. I have no risk factors. Who lives long will be at risk of colon cancer or rectal cancer in the future. So if no risk factor doesn't mean that you will not going to suffer from colorectal cancer. So these people are also recommended for colonoscopy. Only men get colon cancer. The scenario is that there is equal frequencies of colon and rectal cancer in males and female. So females are having the equal percentage of colorectal cancer. So recommend females also colonoscopy. If you got screened, pass the message to your friends. I got my screening and so you can. No more excuses, no ifs, ands or buts. So what should I do to prevent this colorectal cancer? Quit smoking, start daily exercises, control your weight, eat fresh fruits and vegetables, get screen yourself and limit alcohol use. The ACG has published their figures in the last year and they have mentioned that colon cancer it is the second leading cause of cancer death for American Indians. So you can imagine the prevalence picture in US. It is same happening in India also. This is a very nice figure. You can see this year around 50,000 people are going to die because of colorectal cancer. So we are going to save about 50% of these people with screening and other people who are diagnosed or undiagnosed what to do for these people. So ask your doctor about a colonoscopy. Thank you very much for your kind attention. Oh, my OPD timings are Monday, Wednesday, Friday, 1 to 2 p.m. I am doing all oncosurgery cases, including all uro-onco cases, GI onco cases, breast onco cases, thoracic onco cases, then head and neck onco surgery, then soft tissue sarcoma surgery. So any one of your friends or colleagues or any general practitioner, if you are having any onco opinion query, so please visit at Curia Hospital. I would like to say thanks to the marketing team of Curia Hospital, the digital marketing team of Curia Hospital for giving me an opportunity for this live session of colorectal cancer awareness and screening. If any one of you having any query regarding the colorectal cancer or any cancer, so my contact number is given at the below screen. So please share this number and contact.